the Expire Show, brought to you by Science Center Singapore, the Singapore Institute of Technology, and Neo Aeronautics. And tonight we have a very special speaker who also will share the experience of the invention or the innovation that she is going to talk about. So let's go and visit and talk to Dr. Ng Cai Lin. All right. So, as usual, I am not going to address you as Dr. So I just use our name, right, Cai Lin, okay? So, very nice to meet you, and so maybe you can explain to us what is Hicura, what is this word all about, and bring us through the stories of how you create this innovation.
Okay, thank you for having me here, Kok Ping. I mean, it's a pleasure for me to be here to talk about my innovation. Hicura, what does it mean? It means high accuracy, actually.
Oh.
So a high level of care. So it has different meaning to different people. For myself, it's really about having a high level of care for patient. So I was a patient myself. I went through 2 cesarean. My second cesarean was a terrible one. So
no, wait. You are a patient. I thought when you go through a cesarean, you're going to be a mother, right? So you're not a patient. Are you still consider yourself a patient?
No. I was not a patient anymore. I was a mother.
I still am a mother. You're still a mother. But when you're going through pregnancy and delivery, do we call you a patient? No?
Well, yes, because the doctor is doing intervention on you, right?
I see. Okay.
Yes.
Yeah, okay.
So yes.
Sorry.
And it's a cesarean, it's a major surgery.
I see. Okay.
Yeah.
So cesarean is a major surgery.
Yes, it is.
Natural birth giving is also
It's a very traumatic experience.
I have 3 kids, I know. Not me, but my wife.
But your wife, yeah. So did your wife take epidural?
Once, I think. Once,
okay.
yeah. So the painful part of it. So yeah, carry on.
Yeah, so for my second cesarean, I had a traumatic epidural. So the doctor was using, they set me up, put the epidural in, but then it was not working. And so they have to remove the needle, put again, and then it still didn't work. And then they increased the dosage. So it was rather traumatic.
Yeah,
but in the end, everything went well. So
yeah, that's good. But I think a lot of audience here probably don't understand what is epidural. Yeah. What's that process?
Yeah. So the process is where, okay, so first of all, I must say that epidural is the gold standard of pain relief for labor. Okay, so it's widely recognized by WHO that is the gold standard. It offers the best relief of pain. But the epidural procedure is done via needle insertion into the back, into your spine.
Okay. So it's scary, right? Into the spine.
Yes, and it actually goes into the epidural space, which varies for a normal. For myself, it's about 4 centimeter. For others, for example, a heavier person, it may be even more.
So there's a space in the spine that depends on the individual.
Yes,
okay.
And later I can show you in my slides what the whole spine structure looks like and how the needle is going in. So there's only a small little space for the needle to go in, and the needle must reach a certain epidural depth, and that's where they will inject some anesthesia to numb the nerves. So to block the nerves, so then you'll get complete anesthesia, so which means that you don't feel anything, and then that's where the pain relief come in.
Okay, so you poke a needle into a epidural region inside the spine, and that sort of what they call reduce the pain or remove the pain, numb the nerves so that there's no pain, and therefore can deliver better,
correct,
right? Okay,
correct,
all right,
correct.
got it,
yeah. So, but then the important part is that the needle must be at the correct space. So if there is multiple punctures, you get an increased risk of infection. And in some cases, if let's say the needle goes in too deep at the wrong level, too high, it might hit the spinal cord, which is very dangerous, so which might cause paralysis. Although I must say that epidural is quite a very, very safe technique now. There's not much complication, but being such a safe technique and which a lot of mothers have to go through, we don't want to take our chances also.
Safe technique is because you have very people skilled in using the needle.
Yes.
Right. Okay.
Yes.
It's like we take vaccine, right? it's not painful because it's so skillful.
It's more complicated than
I can understand. I can understand.
Yeah, but then when you have medical officers or residents, those that just graduated and going into it, then they will have to do a lot more practices before they are qualified to be one.
That's right.
So yeah, so that's the experience matters. So that's where we think that could be a better way. Actually, this project was a research collaboration between KKH and NUS. So the doctors in KKH, actually is Prof Alex Xia, who is the CEO of KKH right now. So he is very forward-looking, so he has an idea. So why don't we use ultrasound to do epidural? And this is already highly recommended by medical society, and also there's a lot of literature on it already to say that actually using ultrasound is increase the safety. But then not a lot of doctors are using it because of training. So these are anesthetists, right? So they are not sonographers. So if you want to perform an ultrasound and you want to know the structures, basically you either need a sonographer to be with you, or that you undergo many hours of training on the ultrasound, really to identify what are the spinal structures. So he thought, hey, now AI, right? We can use AI to automatically identify these structures. And then it could be just that the doctors is scanning, and then the AI is trying to tell them, oh, this is the sacrum, this is the L5, L4, L3, and that you should be going to this level. And so it becomes very intelligent, and the doctors then that barrier to be proficient in ultrasound becomes that much lesser.
Okay, so I think I know what it is. For our audience, when you start talking L5, L4, L3, it's like, okay, you mean which level? So maybe you want to step through the slides and we can then go into details.
Sure. Yeah. So USign is the name of the product. What we are trying to do here is to reduce the number of needle puncture attempts when you are doing epidural. So, and this spinal anesthesia can be epidural for women in labor, and you'll be surprised to know that 6 in 10 obese women require multiple punctures for epidural. And this spinal injections or spinal anesthesia is not just for women in labor, it is also for seniors who have to go through knee or hip replacement surgery, and they will need spinal anesthesia. So 7 in 10 seniors actually require multiple punctures. Or even in kids, when they go through lumbar punctures. So if you have unexplained fever, or the doctor suspect that you may have meningitis, then they will usually perform a lumbar puncture to extract the cerebrospinal fluid from the spinal canal. Okay. So if you have 3 failed attempts, they will actually stop the lumbar puncture, let the body recover. Next day, then they will do. But then this delay the treatment, because if you discover that you may have bacterial infection late, then the treatment starts late. So if you improve the procedure of lumbar puncture, then this might help.
Okay.
And this is what I was trying to say. So you have now you have a visual of what is the spinal canal, where is the bones, and how the needle is going in.
So the lower you go, the numbers increase.
Yes, correct.
Okay.
So you have a sacrum at the bottom. But what I'm trying to say here is that the optimal level to put the needle is usually between L3 and L4 spinal segment. Okay. So why is that so? Because if you are going up too high, you might hit the spinal cord. It usually ends around L1, L2. But if you are going too low, the nerves at the intended area might not be blocked. So you get ineffective anesthesia. Right. That's the first thing, the level, it must be correct. The second thing is the angle of the needle insertion. So it must be at a certain angle. So if you see here, right, the needle goes in between 2 bones. So if you imagine the needle goes in the wrong angle, it will hit the bone and you cannot proceed anymore. So you have to take out the needle and you have to do a reinsertion. I see. So the angle is important as well. So how the doctors are doing this is by using palpation. So they're using their fingers to feel for the bones, get to the right location by feel. And this places a very heavy reliance on the doctors, the experience of the doctors, the interpretation of the doctors. It's blind to target because you don't really see the needle actually going in, and it's not effective for obese patient where you can't feel anything if you are a huge layer of fats. Okay. So basically for the obese patient, the needle actually going in blindly . So the first attempt success rate for obese patient only 43%, which means that more than half of this requires multiple punctures. And 90% of the clinicians actually use palpation method routinely. Okay. That's where we are trying to encourage people to use ultrasound. Because by using ultrasound, you'll be able to see the spinal structures, you'll be able to know where is exactly where the needle should be going in. But of course, like I said just now, there are some difficulties as well, because when we are transiting from palpation to ultrasound, you need to have that level of confidence for the doctors to actually see that, okay, this is the right spot, I'm going this spot, and to trust in the ultrasound. And to trust in the ultrasound, which means they must have a high level of interpretation of the ultrasound images. That's where we try to come in. So you can see that the first attempt success rate actually increases to 77%, which is almost going to be double. But only 8% of the clinician uses ultrasound frequently, and that's where we are trying to solve this problem.
Why only 8%? Because they're not familiar.
Yeah, they're not familiar, they're not confident. They look at the workshop, they can understand what's going on, but when they try it themselves, the images doesn't look the same. So, yeah, and then and the training basically is the training. Okay. So that's where we try to come in. I'll show you a demo of how USign works. So this is our technology. Is a software. It's based on AI algorithm, automatic ultrasound guidance software for precise needle insertion. So I'm going to show you a demo.
Okay.
So first, they are trying to find the level. So when you put the probe on the patient's back, you see all the sacrum, S1, all the different circles, and these are made by us. So the doctors will go up until you see the two lines match. That's where you should put the L3, L4 level should be. And then you've got the center line, but what about the vertical line, the midline? So then you rotate the probe, and then we will have this image, the two lines, you align them again. It's very easy. And then you tilt the probe to find the angle. So then you see the slight tilting of the probe. So when you find the right angle, we will show you what's the epidural space, and even automatically calculate what is the epidural depth. So then the doctors would then mark, and then that would be the right spot where the needle should be going in at the right level of depth of insertion.
So it's direct in, or is there angle?
There's an angle based on where the probe. So when you are trying to find the probe, you tilt it slightly, and then we found the epidural space. This angle should be the one that the needle is going in.
Okay, okay.
So that is basically what the software is doing. And how we set it up. So it's a software that requires an ultrasound machine, but a lot of hospitals right now already have this very huge, expensive and high precision ultrasound machine. What we need to do is to just tag it to a laptop or a tablet that's running our software, and we can use it and we can hook it up by just linking it to the HDMI or DVI output. So all the ultrasound machine would have this output, so we just have to tap it, get the raw images. We do it in real time. When the doctor is scanning, we will get the raw images, and then we display our AI identification. So we are compatible with major ultrasound brands because all of the ultrasound brands would have HDMI or DVI output. We have tested on Sonosite, we have tested on MyRay, and both works.
Okay.
Yeah. So we have also done 2 clinical studies already. That prove the efficiency of our software. So we've done it first on 100 normal weight patient, and we achieve a high success rate of 92% first needle puncture success rate. And next we tried on obese patient, and basically these are the more challenging patients. And we achieve a high 79% first attempt success rate. So right now we are performing another clinical study on KKH with a new improved version of the software that we hope to increase this first attempt puncture even more. Yeah, so if you go to KKH and if you are of a heavier size, BMI more than 30, you're most welcome to ask the doctor about USign to try our software.
Okay, good.
So USign reduces procedural time, leads to better clinical outcome, and what is of most important to me is really improve patient satisfaction. Yeah. So besides being used in a clinical setting, it can also be used as an educational and training tool. So the new doctors can actually use USign to help them look at the structures, to improve the learning, and for this, it will reduce the training time, and as a training tool, regulatory approval is not needed. So it's just you can use it as a training tool. And I'm also very, very happy to say that we are also recognized as SingHealth top 5 research breakthrough over the year, together with even Selena, Carbon Cool, and all that. So we have a lot of support from SingHealth. and they also see that this is a very good technology.
Okay.
Yeah, so that's all I have.
Okay, that's
to show
great.
you what is
That's
the
great.
technology.
So good. So let's talk about what do you call when you want to come out with a technology, right? It's a solution. There is a problem definition, right? So how would you define this problem very tacitly in one or two statements?
The problem.
Yeah.
Multiple punctures for spinal injections.
Okay.
So we want to increase the accuracy of spinal injection.
Okay. And what will be your value proposition in that?
Increase
sense?
the accuracy of this.
Increase the accuracy.
Yeah.
Or is it like, let's say you have a tagline, what kind of tagline would you use?
A tagline that more accurate spinal injection.
More accurate. I was thinking one time right, every time right.
Oh, that's a nice one. We should get you to do our copywriter. One time right, every time right. Okay.
Yeah, so everyone the needle goes in, everybody that's scared of multiple needles going in, right?
Yeah.
Okay, so that's great. So how big is this market? How many patients? When one of the important things for us to solve a problem is also to figure out that, okay, if you're going to spend, how many years have you spent on this project?
I've spent, this project was actually ongoing for quite some time. It was started as a research project in the US, right? I was not involved then, but we may try to commercialize it. We incorporated in 2019.
Yeah.
So I was with the company for 2 years.
Yeah, so 2 years. You probably need another 3 years to commercialize everything, right? So let's say
very fast.
Very fast, okay.
Try to commercialize.
Another 3 years to make it big lah.
Yeah.
So let's say spend 5 years. So when you spend 5 years on one project, it must worth something lah. Okay, not just patient, but we look at the economics part of it, right? How big is this market?
Well, if you imagine how many females there are, how many mothers there are, how many birth rates in
so how would you
in the
compute?
world. Birth rate and the epidural, number of epidurals.
So you compute the numbers of deliveries, birth, right?
Yes.
And based on this percentage, how many percent will use epidural?
Yes, correct.
Is the percentage very high?
Yeah, of course. So in countries like USA, is about going to be 60-70% who have to go through either spinal anesthesia for cesarean or epidural for normal vaginal delivery. So 70% is quite, which means 70% of all the mothers who has to go through birth would actually use spinal injection.
Okay, so let's say Singapore lah. We try to compute the market. In Singapore, what is the number of baby borns a year? Now a bit lesser, 15,000 or 12?
No lah, I think about, I can't remember, 30 or 40,000.
30,000. Okay, we're going to check the numbers.
Yeah,
because I remember we have per cohort, right? Per school students go into the cohort is probably at 20,000. Nowadays it's dropping and dropping. Assuming it's 20,000, right?
Yeah.
Then percentage of a mother using an epidural is
40
like
to 50. About,
40 to 50,
yeah.
right? So let's say, assuming 50, let's say 10,000, 10,000.
Of course, Singapore market is the smaller market.
I understand, but we can always multiply. Singapore, we know the population. So per operation, per epidural operation, how much does it price?
So there are different way of calculating that. There are usually the anesthetist fee that you actually pay to the doctor,
Correct.
the anesthetist. So they usually charge between 600, 700, around that range lah. It also depends on whether you are a public hospital or private hospital. So
it doesn't
of course
matter
the
lah.
private hospital.
Whether public, private, government will subsidize, right? And then but
no, the anesthetist for a private anesthetist, they will earn about 600 to 700.
So assuming,
and if it's a cesarean and they have to stay there for the whole procedure, I think they can earn up to $1,000.
So assuming $500, assuming $500. So $1,000. So $1,000 times, let's say 10,000 epidural operations a year, right? 10,000 times $1,000. That's 10 million in Singapore, which means you multiply worldwide. It's quite a sizable number, right?
Of course. Yeah, and it's not just for epidural. We also do spinal anesthesia. And a lot of elderlies or kids, they actually can't go for GA, they will do spinal anesthesia.
Ah, okay. So,
Yeah.
so that's the expansion.
So that's another, so it's not just
application.
for epidural, but it's also for surgeries. For like I said, the knee or hip replacement surgeries, typically the doctors would recommend spinal anesthesia.
What inspired you to join and start this? What's the background?
So like I said, my second cesarean was very terrible. But I was an electrical engineer by training lah. So I got to know this project when I was doing my PhD in NUS. So my professor was doing this project, and then when I graduated, he invited me to be on the team, and so that's how I started in the commercialization of USign.
All right. So this is a medical project, but you need an electrical engineer, because it's just ultrasound plus software.
Well, the thing about this is that I was doing my PhD with NUS NGS, so which is NUS Graduate Society of Integrative Sciences and Engineering.
Right.
So so most of the problems right now requires multidisciplinary collaboration. So you don't just need a doctor, you also need engineers. You also need a software engineer, hardware engineer, everybody to combine their minds, maybe even meet a mathematician, physician, to combine their minds together to come up with a good solution that can solve real world problems. So I believe in that lah. That's why I think when I joined this program, NGS, I think it's a great program.
Okay.
Yeah.
So you get a PhD, why don't you go and teach?
I was teaching in a polytechnic before I went for my PhD actually.
Okay.
Yeah.
So you get a PhD, why don't you teach in a university?
Then it boils down to the reason why I did my PhD lah.
Yes.
So I have to go to a little bit of history why I did my PhD. So after I graduated, which was a very long time ago, as an electrical engineer, I was working in Micron, a semiconductor company.
Okay.
So then I was in Micron for 4 years as an engineer. And then when I look at the whole engineering firm industry, as a female engineer, I think the most that you can get to is probably the section manager.
Oh no.
And then maybe, when we look at the career path, when we look at the career
Actually,
path.
not true now.
Not true now. That one, okay,
You look at a lot of software companies in Singapore, whatever, the top guys are all female,
Yeah. So right now, software company and that in the past, a very technical engineering firm is a little bit different lah. Right? I mean, now I'm quite sure Micron has a lot of female top leads as well. But then I decided to be an entrepreneur.
Okay.
So that's why I left Micron. I think that I wanted to develop some of my soft skills. So I joined IDA, which is now known as IMDA lah, as a project manager dealing with the next gen NBN network, which is the fiber network that we all have now lah. We are enjoying now. So my role in there was curating services. So I got to talk to a lot of people in Infocom, trying to get them to set up shop to have more services that rides on the next gen NBN network. So we have a fiber, right, that use up a lot of bandwidth. But if you don't have services that use up that amount of bandwidth, then it will go to waste. So that was my job then. But the reason why I went to do a PhD was really I wanted to be a deep tech entrepreneur.
I see.
And then PhD or university environment will actually give me the resources that I need to be a deep tech entrepreneur.
Okay, let's talk about entrepreneurship then. So so you have what you call impetus to want to be a deep tech entrepreneur, and you select this project, very meaningful and I think very big market. So for this project, what do you envisage? What are the various stages that you need to go through or you plan such that you can bring it to the market?
The first stage is actually the first of all is that you need to have the market first.
Yeah.
So you need to have the problem, the market, make sure that both are there. So you need to have a real problem that you're trying to solve, that the doctors say, I think there's a better way to do this.
Yeah.
I
will redefine it where you need to have a problem, you need a market. And a very big market.
Then the next is the technology.
Okay.
So then you need someone to build the technology, right? For MedTech devices, we need to make sure that your technology is sound. So we need to go through clinical trial.
Okay, so
the
you need
next
to
step
do
is clinical trial. To
okay.
make sure that technology is working. So after clinical trial, you have to go through a lot of verification and validation tests before you get regulatory approval. So then the next step is regulatory must look at the company, the quality management system, whether you are a reputable company, you have totally verified that your technology works, and to what extent, and what are the risks. You have to do your risk and benefit analysis. And then once they ascertain that this technology is good to go, then you can commercialize, you put it on the market, and then to sell your technology to your end customer, which can be hospital, can be patients, can be anyone who needs to use a medical device.
Okay, so you're talking about the product development process, right? For medical devices, regulatory, clinical trial regulatory, and then the QMS or quality management system and certification. But you have never been trained in this. So
that's the difficult part about entrepreneur. Nobody would have been trained in every single one of them.
Yeah.
It's impossible. And that's why for someone who is starting out to be an entrepreneur, I would really encourage them to come in either pairs or 3 of you to form a team. And that each of y'all would have your strength that would complement each other. And then afterwards you can hire. So then you can hire your QA/RA guy to help you do your regulatory. You can hire even more software engineers to help you do your testing and validation. And maybe a finance guy or marketing guy to help you sell.
Okay, so there's one peculiarities here, which is like you are actually developing a software, right? You're using existing ultrasound equipment, but develop the software. So is software a medical device?
Yes, software is a medical device.
Why? Software is a software. I thought medical device are like piece of equipment.
But so in the past, when you have equipment, medical equipment, there are already software running inside it, and then there is a quality management system that actually requires you to validate your software, 62304. Yeah. So you have to go through very rigorous saying out what is your software architecture, do your testing of the different modules. So it's actually quite rigorous. But then that one is still a software that's in a medical device. But recently, now there are more companies that are using a pure software like us. But then we cannot say that it's not a medical device because it's actually influencing the doctor's decision to do certain things, medical procedures. So it is still a medical device.
Okay.
And so right now, I think a lot of regulatory authorities have come up with a new term called SAMD, software as a medical device. So yes, it is a regulatory term, and there is even a document on what is a SAMD and whether you are a SAMD. Now, of course, there are certain apps. Then we talk about apps, right? So in a handphone, you can download some apps that say that, to keep a healthy lifestyle, you should do exercise, how many exercise and all that. So for this, if they want to term it as okay, so I'm not the expert here. Maybe in the audience, if there's some expert, you can post on the chat or something that you can share your opinions there. So basically, for those, if let's say they want to be SAMD, they can apply to be one. But if they are not, right, I think they usually would say that this is not a
lifestyle device.
This is a lifestyle device, and this is not for. They have some disclaimer to say that. So then they don't need regulatory approval.
So a medical device or something that is considered medical or certified as medical is for you to make a decision or diagnosis for your body, right?
Yes.
And you use it to do something, right?
Yes.
But if it's just for exercises and all this, then it's not
lifestyle
considered.
Is not considered.
Yeah, it doesn't treat your body that way. Okay, so that's the difference. Okay, I think a lot of people will be confused why is software a device, right? It's just legal definition.
Yeah.
Okay, let's talk about business, right? So from a PhD, right, and you want to be an entrepreneur, right? What are the challenges that you face, right? Transitioning from the academic world into the business world.
In the academic world, there's always the right answer. You have a question, you answer it, there's always the right answer. You get it correct, you get your marks. You don't get it correct, okay, then the teacher will teach or the lecturer will tell you what is the correct answer. There is never a correct answer in the real world. When you're an entrepreneur, nobody would say that what you think that you are doing is right or wrong. Okay. You have to decide yourself. So you must have the confidence to say that, to acknowledge that what you are doing is what, at that moment, what you think is the right way, and then you move on with that. So of course, there would be a lot of, I'm quite sure none of the entrepreneurs have never made a mistake before, but you learn through the mistakes. So in academic world, a mistake is just minus mark. But in as an entrepreneur, a mistake can be very costly. But that's how the learning process is. That's how you grow as a person, as an entrepreneur, and that's why there are a lot of failures, but there are successes as well. And you go through all these failures, and then eventually, if you don't give up, you'll be a success. But if you give up, then you can start on the next journey that you can try to be successful.
That's an interesting point, right? You said whether you will give up or not. So if you want to enter entrepreneurship, right, and what makes you won't give up?
I guess there are many times in my journey with Hicura that I want to give up lah. But it always boils down to the passion that I have and the reason why I choose this project instead of my PhD project. So my PhD project, I was doing a ear surgical device. Ear surgical device for kids for otitis media with effusion. So basically why I choose the Epidural project was my own experience. So I wanted to make it better for my sisters, for my wife of my son, the future wife of my son, so that they won't suffer the same as me. So it's really my own experience, and this is what is driving me forward. So during the entrepreneurial process, I always comes down to the point whereby, hey, why do I want to do this? Because I want to improve the things in the future. Because it's not just to make money, it is really so that when I see a happy mother, I get the satisfaction.
So it's a passion that drives.
It's the passion that drives you. You always have to hold on to that passion, or else it's very hard to continue as an entrepreneur, especially in the medtech industry.
Yeah, okay. So now but what are the challenges, right? Then you have to deal with people, you deal with money, right? And money is never enough. So how do you handle all this stuff?
So I guess for Singapore, it has been quite encouraging for startups. So they have a lot of grants that we can tap on. So we tap on the Enterprise SG, Startup SG Fund, the POC Fund. So we got 250K from there, which helps us along. It's great. But right now we are still raising fund. We are trying to raise our next round. And so if let's say, like you said, money is not enough lah. We want to have a very aggressive growth plan. We need to have money injection. Besides money, of course, like what you said, people lah. So we need to hire the right kind of people that will work with us. So those two really, like you pointed out, is quite important for us for any startup.
Yeah. So one of the important thing of the startup is obviously you need to have you need to have a team, right? So not just one person, right? So preferably one in business and one in technology. Doesn't mean business must come from business school, right? As long as they are business minded, okay? But you need a lot of help from people, right? With different expertise. How would you structure or go around getting these people?
You talk to people, lor.
You talk to, drink and that talk with people.
And then you get a sense of whether they are there genuinely to help.
Okay.
Or whether they are just giving advice and then walking off, and then if you need advice, come to me. But then there are, recently we had John Teo, who is from IPI, who is helping us, and he has been a great help. So he was there all the way. So we had regular meetings. He helped us with our QMS. So he's a really great guy. So he came in, and then he put in investors. He put in a lot of advice. Give us a lot of advice because he has been an entrepreneur before, and he started his. He went to US to try to do his startup as well. So he could offer us a lot of very valuable advice. So this is one person that I would say has been a great help to us.
So you go around looking for advisors or consultants, preferably don't pay them, people will help. But I think in Singapore, there are a lot of helps.
Yeah, exactly.
Yeah. But typically what we do is also we will set up a scientific board or advisory board, right? Some will advise on the business, some will advise on the science of it, especially when they are in high-tech. Maybe we can go and take a look at a couple of questions before we talk about other stuff. So question 1, right? what other types of surgery will you be using would you expand into using your
Oh, that's a very
sign?
interesting question, because right now you can see here that we are locating the spinal landmarks.
Yes.
So we do it mostly for spinal injections. But then actually the technology is there, our algorithm is there. We can actually expand to anything that the ultrasound is scanning, even the shoulder or even the back or the neck. So this has a lot more application. So anything that uses ultrasound, we can actually use AI to try to help to guide the doctors to put either the needle or any intervention that they want to do.
Let's take an example. Let's say knee. Knee got a lot of people have a lot of problem with knees.
Yeah.
And when I say a lot of people have problem with knees, right? So the kneecap or whatever, right? That means big business, because big market,
Yeah.
right? So what can you do with knees?
So it depends on whether what the doctor wants to scan. So if let's say they are using the ultrasound to locate a certain part of the knee that they want to see what is the problem inside, then we can help them. So it can be diagnostic to see whether there's anything wrong with the kneecap, the shape of the kneecap, or whether anything. I'm not very, I don't know knee that much, but bony structures, ultrasound can pick up. So they can tell you what's wrong with the thing. So diagnostic is one of them that we can help to do. We can help to do measurements on the knee. We can help to see even deep inside if there's nothing blocking the knee. If there's bone blocking the knee, then the ultrasound cannot penetrate. But another thing that ultrasound is actually good for is for healing. So ultrasound wave can actually do some healing on the knee. So, but then where you place the ultrasound to do the healing is also a thing that you probably have to know. So we can also help with that. So basically, ultrasound is a technology that has many users, and if you need any guidance on top of ultrasound, it's a huge potential for us to go in. And ultrasound is an imaging modality.
Yeah.
Yes, X-ray. There is CT, there's even other things that's using imaging. So of course, AI can be used in anything. For ultrasound, that's our first use. And why we choose ultrasound is very simple, because doctors can use ultrasound anywhere. It's a non-ionizing radiation. You can use it in the clinic, you can use it in the hospital. There are some like X-ray or CT, you can only use in a hospital because it requires a big machine. But ultrasound, right now, even there's portable ultrasound that you can use. Vets, animals, you can also use ultrasound on animals. So ultrasound can be used anywhere. That's why we picked ultrasound as the first imaging modality. But of course, it's also epidural because pregnant women you can't have, right? So basically, what I'm trying to say is that ultrasound, wherever ultrasound is used, is a potential for us to go in. And even beyond ultrasound, there's even X-ray, CT that we can also go into.
So you mentioned that your software is AI, right? So AI is a very big word.
Yeah.
And it's a very big buzzword. So a lot of people will say, oh, when you want to set up a new company, you must have AI. So what is really AI? Not many people understand. Maybe you can talk about how is AI being used in your software? How actually it works?
Okay. So AI, artificial intelligence, there are a lot of things under artificial intelligence. There's the very basic neural networks. There is SVM, supervised vector machine, and then you have the deep learning kind of artificial intelligence. And of course, right now, the buzzword is deep learning. Deep learning. Everybody wants to use deep learning.
Okay.
Right. For medical wise, what we are using right now is SVM, supervised vector machine. So what we do is that, so deep learning has its good users, but one problem that deep learning faces is that it's a black box. So basically, when the algorithm found something, most likely they found it is accurate, but the doctors don't know, hey, why did the deep learning, why did the algorithm find that thing? It's a bit strange why they managed to find this thing. So then there's a lack of confidence, but we don't know why they found, are you sure it is? But for what we are trying to use now, right, is SVM, it requires a lot of collaboration with the doctors. So the doctors would actually do the scan, and they would tell us what are the landmarks. And then we would train our algorithm based on the landmarks. So when the doctors see it, this is the landmark. Yes, we have identified this is the landmark. There's a high confidence. So when you are scanning, you see the landmarks, we identify the landmarks, it builds the confidence. So when it goes to an easy patient, you build the confidence that you see what our algorithm is doing. And then when you go to a difficult patient, whereby it becomes really difficult for an experienced doctor to actually really identify that this is the sacrum or the spinous process, our algorithm can still do it. Because when you see what you see from the eye is not what the pixels tells you. So we have an even deeper way to actually filter out and then get the images quite clearly. So when you see the image, although you don't see it, but our algorithm does. So when you go to difficult patients and then we still get it right, and they know that from the previous confidence of an easier patient, we know that it's correct, they have more trust in the system. So that's how we do it. That's how we do it, and that's how we gain the trust of the doctors.
So it's like a master telling apprentice, okay, this is done, and then you record it, and that's in the brain, and then it continue to acquire the knowledge. Right?
So for us, we really require the doctors to do annotation.
Yeah.
So we had, at the start, I think we have 40 volunteers. So we do the scan on 40 volunteers. So doctors will have to tell us exactly where is the sacrum, where is the spine. So it's a very close collaboration with the doctors. So the doctors actually play a very big part in our software. Yeah.
Very good. So question 2, move away from the deep tech thing on the entrepreneurship. What would be your best advice for budding entrepreneurs,
What would be my best advice? I think start young.
Start young.
Start
okay.
young, where you have
a
a
lot
lot
of
of energy. Unfortunately, that's true. Because you gain from the experience. I would say start young, but I would still encourage people to actually go and have some work experience first before you start entrepreneur. Just to get the practice of the industry, how people do work in the industry, the talk, how you talk to people. So as a fresh grad, maybe you have a very idealized image of the world, but actually it's not like that. So I would still encourage people to have 1 or 2 years of work experience before you actually go on a journey of entrepreneur. My best advice, find your passion. That's what that would stick with you as you go through all the mistakes. And the second one is to find the right co-founder, is to find the right people who will work together with you. Actually, one of the biggest failures of startup, one of them is actually the team. Yeah. If the team breaks, the startup breaks. So find the one person that you have known for a long time to do this with you.
Okay. So now you are, okay, we have a question 3. Okay, let's see. Oh, this is challenges again, but in the 3 to 5 years horizon, means planning ahead. Any plans, how do you intend to overcome them?
What are the challenges you foresee?
Yeah, I think the 3 years getting your product certified is the more.
Yes, so right now we are already ISO 13485, so we have our QMS already. So right now is to go through regulatory, but next year we should be able to get the regulatory. In the next 3 years, we'll be expanding to other markets. So the challenges that we will have is to go to other markets and to try to break into the other markets. So we already have a competitor in USA who is also doing the same thing as us, although they are not using AI. So they are a different model. They are a portable ultrasound machine. But for us, we are utilizing a complex, high-end ultrasound machines or multi-purpose ultrasound machine that the hospital already own, and to have our software on that machine. So the business model is a little bit different, but really, how are we going to enter into the US market? We're also looking at Europe, we're also looking at Australia, UK, all the different markets. So it's really how we're going to break the market. So that would be one of the challenge. And how do we overcome this challenge? I think the same as what we are doing in Singapore. We have close collaborations with the clinicians. So the clinicians are our KOL, key opinion leaders. They are the one who will speak up for us. They will be the one who will introduce our products to their fellow anesthetists or doctors or surgeons. So it will be the same technique. And in any ways, we will definitely need a close collaboration with the doctors to improve our AI even more for those countries. Yeah.
That's interesting. Okay, so we have one comment, maybe it's not a question, but from Jermaine Go, she said that she want to thank you. This is where the passion comes in, right? She want to thank you and your team for improving the lives of many people, especially women. I think it rings a bell with her lah. Giving birth is probably one of the most dangerous, painful point in a woman's life, and that this technology make it better because one time right, every time right.
Thank you, Cailin.
So you have any message for Jermaine?
Yeah, yes. I mean, you are the reason why I'm still on this journey, because I really think that our technology can help. You are actually right that it's one of the most dangerous, because there was even an incident in China because epidural was refused to this patient. She committed suicide.
Oh no.
Yeah, exactly. And that is what changed China's policy on epidural. That was the changing point. So I think it was 2018 or 2019, I can't remember, that China said that they are embarking on a pilot project to improve the epidural rate. So just a little bit of background. China has the highest cesarean rate in the world.
Okay.
And that's because it's either you go epiduralless, that means you don't have epidural and you go through vagina.
Oh, you general anesthesia, just
yes, exactly.
knock out and then get the baby out.
Yeah. So that's why the cesarean was so high.
And especially now China say, we should have more babies because there's so lack of babies, right? So it will have a baby booms, huh?
Yeah. So China embarked on a pilot project to improve the epidural rate. So they had a pilot project working with 900 hospitals, and I think the results were amazing. So they improved for the 900 hospitals, the epidural rate is now 50%. Yeah.
Okay.
So yes, epidural is really the gold standard, and I would still encourage everyone to go through epidural, but with a safer technique using U-sign.
Sure. So maybe we can look at Jermaine and she was like, oh, she's excited about this thing. So do you need interns?
Oh yes, please join me. So
So what kind of people you need to help you out in?
Startup will require all kinds of people. There's always things to do. Software, if you are not engineer, you can also help in the marketing, doing research, doing our documentation. I need someone to do my QARA. I already have one amazing guy who's doing my QARA, but there's so many other markets that I'm looking into. We need to do CE, we need to do FDA, we need to do HSA. So there's a lot of things to do. I would definitely welcome any interns.
Okay, very good. So let's talk about valuation, very touching numbers, right? So you don't need to answer really exactly. What do you think is the correct valuation? Eventually, it will be tied to your plans, right? At what stage, what kind of valuation? I mean, rough numbers will do.
You mean at the technology right now?
Yeah, from the start to progressing onwards.
My face very thin. I don't want to say that I'm aiming for a unicorn. So right now, because right now we are still not on the market yet, so we still haven't gotten our regulatory approval, which means it's a higher risk for the investors. So right now, I would place my valuation at about 4.5 mil.
Okay.
Yeah, and I'm actually really looking for investors to come in, to invest. And in the future, when we expand into the different markets, US, Europe, and even China, if we find a good collaboration partner in China, then of course our valuation will be higher. And because of the fact that we are using ultrasound and there's a lot of users for ultrasound, our market is actually very big.
Yeah, why can't it be a unicorn? You just need to look at the numbers, right? Let's say whether it's China number, Indonesian number, or whatever, right? So let's say China is an example. How many births per year? And
12 million.
Let's say you go by the percentage, right? 50%.
Yeah.
And maybe higher because they encourage more, right?
Yeah.
So when you look at the numbers, it might possibly be one, right? Okay. So maybe let's talk. There are a couple of things that you mentioned that the audience probably not very clear, right? What is you mentioned a lot of RA, QA.
Yes.
What are those? and you liberally just throw out numbers like ISO 13485. Yeah, we probably don't understand.
Yes, so QARA is Quality Assurance Regulatory Affairs lah. So basically what they do is that they make sure that the company has a proper quality management system. So it's the same as ISO 9001. So everybody knows ISO 9001.
No, we don't know. So what is ISO 9000?
9001. So that's so in the MedTech world, 13485 is equivalent to 9001.
Okay.
So it's a list of standards that you would require to make sure that your company has the right, system of doing things.
Okay.
Yeah. So for example, if I want to purchase something, then what is the step to make sure that the supplier is qualified? What is the step to make sure that when you receive the item, this item is qualified, has no defect? What is the steps that you go through to make sure that the things that you're receiving from is good, of good quality? And then after that, how do you raise what are the procedures lah? A set of SOP lah, standard procedures. How do you raise a PO? How do you pay money? If there's defects, what do you do?
Yeah, okay.
So these are the set of standard operating procedures that your company must have when dealing with all different types of situations. So it's
very systematic,
yes,
and it's processed, well defined. Yes. It's not like today I want to do this, tomorrow I want to do that.
Yes, correct,
yeah?
exactly. So basically, what we need to do is to come up with a set of system, but it's not just writing out the system. You have to implement and make sure that all your staff who is working in the company adhere to the system, and they are doing it according to the system. So the system will say that, oh, you need to generate PO. Then you must make sure that the person doing accounts must generate a PO. When you receive the product, you must make sure that you must go through all these checks. And then you must have tests that you did this test to make sure that the product that you receive has passed these tests, and there must be a report. So the QARA is the guy that makes sure that, first of all, that you have standard operating procedures in place to make sure that you are doing everything in the proper way. Secondly, which is to make sure that your staff are trained to do this according to what the standard operating procedures require them to do. And third, that there's a proper reporting, proper documentation that these steps have been done, and to sign off that this has been done.
Okay, good. So I think for us it's about time, so we'll like to take this opportunity to thank Cailin for joining us for this 1 hour session on very interesting things, actually a very interesting technology to solve actually very, very important problems to encourage more painless delivery.
Yes.
Okay, so we will have another speaker coming to join us next Thursday. All right, and who's that? Dr. Ling Jing. She will be talking about Soy Energy. So what is Soy Energy? It's actually using, well, it's deal with soybean and comes out with something extra from what is originally soya milk. But I'll keep the secret up to 16 September. I'll see you next week.
That's food tech.
Food technology.
Oh,
so see you. Bye.
Thank you.
Okay.
Okay.
Good.